Hello and welcome to my channel. My name is Morgan and I'm currently working on a master's in clinical mental health counseling, and I make videos about topics related to counseling. If you are a grad student or just interested in psychology, please consider subscribing to my channel. I do want to warn everyone that today's discussion includes references to eating disorders. This is just for informational and entertainment purposes. Please do not use this as a substitute for therapy. Today's video will focus on obesity as a sexually attractive feature in women in Mauritania and the practice of Leblouh. After researching this dark topic, the impact that this may have on a client includes body image issues, eating disorders, trauma from child marriage, internalized objectification of women, distrust of authority, health issues like breast cancer, and trauma from poverty. In Mauritania, economically underprivileged girls ages 6 and up are force-fed up to 16,000 calories a day through drinking animal fat and camel's milk at fattening camps in order to prepare them for marriage. 3 out of every 4 girls have been force-fed in rural areas of Mauritania, while less than 1 in 10 girls in city areas have experienced this. Traditionally, women who are curvier and or heavier are considered more attractive, a physical preference that is influenced by the food scarcity in the area. Counselors who intervene to address the trauma caused by Leblouh need to be respectful of cultural values of beauty and the practice of traditional rituals while directly addressing the negative impact of these specific actions. This requires tact and cultural humility. A client with this history likely has an unhealthy relationship with food. Intuitive eating can be a useful technique after recovery, as a client needs to have already established proper coping skills to combat disordered eating and disembodiment. First, a counselor can assess the client's relationship with food using the Sterling Eating Disorders Scale and the Eating Disorder Inventory 3. Residential treatment for eating disorders could be extremely triggering in this case, as it would mirror a fattening camp, so not good. To ensure continuity of care, counselors should refer a client to a registered dietitian or a doctor experienced in working with eating disorders if they are not already working with someone, and then obtain informed consent to collaborate with this other professional. Body image issues would likely arise for a variety of reasons. Perhaps a client who has been taken to a fattening camp in the past feels like they're not attractive because they haven't kept on the weight, or an immigrant feels like they're too heavy to fit American beauty standards. Cognitive behavioral therapy can help a client identify core beliefs about their body or personal image, such as my body is not feminine enough or I'm not sexually attractive, just as an example. Bringing the client to an awareness of the media they consume that reinforces these ideas is also a helpful step. Counselors should also encourage the client to pursue healthy social relationships, as these are one of the first things to suffer when a client is embarrassed and retreats from the public eye. Social support also increases their protective factors. So thank you so much for coming to my channel and watching this video. Please press the like button if you found this interesting and you would like to see more videos like this.